Bottom line is most fevers is the body telling you that something's wrong, not necessarily needing to be treated. So not all fevers need medicine. So the things to be concerned about are children that have a fever more than 100.4 for children less than 3 months. Any child with a less than 3 months who have a fever of 100.4 or greater needs to be seen. That's just a flat out given, because there's so many things that babies can get that are of concern. So it's always good to check. From 3 months to 3 years, any temperature over 102.2 needs to be seen. But there's a caveat to that. They can have a temperature of 101.8 and they're not eating, they're not drinking, they're lethargic, they're not your normal kid. That's a kid that probably needs to be seen. But if they have a temperature of 101.8 and they're running around and they're jumping up and down and they're playing, they're eating, they're drinking, give them a good 24 hours before you may need to be seen. So the bottom line is that fevers are not always an indication of something terribly wrong. Some kids have fevers when they're breaking teeth. They get a mild fever. Some kids get just a fever prior to getting a cold, and they get mild symptoms, and 24 hours later, they're fine. Kids that I'm concerned about are the kids that can't keep any fluids down. So any child that has any fever and cannot keep themselves hydrated needs to be seen. So school-aged kids is the same thing. If they're running around and playing and they've got a mild fever, they don't necessarily need to be seen. Treat with keeping them hydrated, and you want to treat with ibuprofen or Tylenol. Follow the package directions on the Tylenol, but the package should say that it's for 3 months or greater in age. So any kid less than 3 months, you want to call to verify dosing for that. And never, ever give aspirin. Aspirin has a potential to cause a condition called Reye's syndrome, and that's some significant neurological damage. So aspirin is never recommended for any child in any age group. Ibuprofen, Tylenol, and the big picture in my brain is that if you are concerned, always call your provider, always come in to see your provider. There's no reason why you shouldn't. I think what my goal is now is that even if I help keep one kid out of the pediatric ICU, I've done something. I have come to love Carlisle and the people in it. I just wanted to thank for everybody that comes to Sadler and puts their trust in us. Sadler puts the health of our community at the center of everything we do.